think we were slowly coming out of the shadows of stigma. We were taking, it was slow, but definitely there was much progress. Unfortunately, with the pandemic, uh, I was a bit sad and I am a bit concerned because there were several people who, in a way, hijacked the conversation and they trivialized and minimized mental illness, and especially those of the sufferer and the families of those suffering, by making judgments and passing harsh comments, which in a way I think has possibly made us have a setback in the dialogue, in the discussion. So I'm hoping that in 2021, we would be able to move forward and overcome the setback with more and more people coming forward and more people actually being able to address issues, mental health issues, as part of some of our social and psychological issues in our country. That mental illness is not purely a biological issue, that mental health is also influenced by some of the prevailing social issues and some of the prevailing psychological issues.
No, I'm really glad you brought that up. I did feel this summer, actually, for the first time, quite distressed at, where we've reached in the sort of national mainstream dialogue. And, there's no sugarcoating some of that. It sometimes feels like one step forward, two steps back. I've asked quite a few people, Anna, especially because given the work you've been doing with the Live, Love, Laugh Foundation as well, somebody like a Deepika Padukone coming out a few years ago, speaking openly about depression, the kind of impact that has. I do want to take a moment to recognize that, Lord, the courage it still takes in India today, right, to talk about, because that stigma is not, many stakeholders are trying, but that stigma is not gone completely. Do you feel that was one of those watershed moments you're referring to? And if you could also bring in maybe one or two myths that you think everyone should now be done with.
I think absolutely. I think for me, she really had at that point a lot of courage to be able to come out and share something that was so deeply personal, something that is so deeply stigmatized, and also take the risk of sharing it at the time when her career was in a good space. So there could be possible consequences, and I think that was really, really a landmark moment and in the area of mental health. So I think that was one thing that we really need to give her credit for, not just because I know her personally, because I meet so many people who actually have shared that, because of her story, they were able to talk about their own narrative. Till then, they were scared. So I think we need to give her the acknowledgement for that. Coming to the next part in terms of the myths, two myths. One is, which I always tell people, one is that depression and anxiety, it happens only to a certain strata of society. And I think that's a complete no-no. The last 1 week, I was in a small town in off Madurai. It's a small town called Rajapalyam. It's about an hour and a half from Madurai. And I met a lady from the rural area, from the poorer class, and she had brought her daughter, and the daughter was clearly suffering. And the mother was able to understand that she's suffering. She may not have a name to it or a tag to it or a label, but she clearly knew. So this assumption that it only happens to a certain social strata, I think that's a complete myth. The second one that I always talk to is, people keep asking me, oh, she didn't, so and so doesn't have anything wrong. They're smiling and giggling, so they can't be having depression, because they associate depression only with immense sadness and anguish. And I say, no, that's a front, that's a cover. And then, of course, unfortunately, I share the example of Kate Spade, who had smiling depression. And I said, did anybody see that what the pain she was going through and what effort and energy it takes to just every day put up this, smiling kind of appearance? So these are two myths that I really think we need to really, really do away with.